USMLE style question. A 25-year-old man is brought to the emergency department after a motor vehicle accident. He was initially alert and responsive, but later became progressively drowsy and unresponsive. On examination, he has a fixed and dilated pupil on the right side. A CT scan of the head reveals a biconvex hyperdense collection that does not cross suture lines. Which of the following vessels is most likely injured? A. Middle meningeal artery. B. Bridging veins. C. Anterior cerebral artery. D. Cortical penetrating arteries. E. Superior sagittal sinus. Answer correct answer. A. Middle meningeal artery. This patient has an epidural hematoma, which occurs due to rupture of the middle meningeal artery following trauma, often involving a skull fracture at the pterion. The pterion is a weak area of the skull where the frontal, parietal, temporal, and sphenoid bones meet. The middle meningeal artery, a branch of the maxillary artery, runs beneath it and is vulnerable to injury. Patients may initially appear fine, lucid interval, but then rapidly deteriorate due to increased intracranial pressure from arterial bleeding. Classic findings on CT scan: biconvex, lens-shaped, hyperdensity, does not cross suture lines, may cause midline shift and uncal herniation, leading to fixed dilated pupil due to CN3 compression. Incorrect answers. B. Bridging veins causes a subdural hematoma, which is crescent-shaped and can cross suture lines, seen in elderly patients and shaken baby syndrome. C. Anterior cerebral artery supplies the medial frontal lobe. Occlusion causes contralateral leg weakness, not hemorrhage. D. Cortical penetrating arteries affected in lacunar strokes, typically due to hypertension, not trauma. E. Superior sagittal sinus. Thrombosis can cause increased ICP, but it does not present with an epidural hematoma. Key learning point: epidural hematoma, middle meningeal artery rupture. Etiology: trauma, skull fracture at pterion, ruptured middle meningeal artery. Classic sign: lucid interval followed by rapid deterioration. CT scan: biconvex, lens-shaped hematoma that does not cross suture lines. Complication: uncal herniation, CN3 compression, blown pupil, coma. Treatment: emergent craniotomy to relieve pressure. Would you like a question on subdural hematoma?